Good morning, everyone, and thank you for being with us today for our Alabama Infection Prevention monthly office hours call. We really appreciate the time that you dedicate to being with us, and we hope that you find this information helpful for you as well. On behalf of the Alabama Nursing Home Association, Alabama Department of Public Health, and the UAB Alabama Nursing Home and Long-Term Care Strike Team, and Alliant, your Quinn QIO for Alabama. We thank you for being with us. I think that you'll find the information being shared today to be valuable. And before we get started with the formal presentations, I would like to just do a little round robin from our team to see if there's any ad hoc sharing before we get started. So Wade Menifee, I'll start with UAB.
Absolutely. Thank you, Beth. Again, Wade Menifee with the UAB and Alabama Long-Term Care Nursing Home Strike Team. Just wanted to share that we are having our 2023 Infection Prevention Boot Camp for long-term care facilities coming up. That is August 24th and 25th and it's at Birmingham. What we'll be covering during that boot camp is the building blocks of a long-term care infection prevention program, emerging and problematic pathogens, enhanced barriers, precautions, and survey readiness, as well as leadership styles and several other things and planned activities. I will drop the link for registration into chat if anybody hasn't had the opportunity to find that registration link yet or haven't registered. We would love to have you. We have, I think, a little over 200 registered so far, and look forward to many more. We certainly got the space, so look forward to seeing everyone.
Great sharing. Thanks, Wade. Katrina with the Nursing Home Association.
Great. Just happy to be here. Be happy to answer any questions anybody has on behalf of the association, and we will continue to share any updates and emerging issues in our weekly newsletter.
Thank you, Katrina. Melanie with the ADPH.
Hey, good morning, everyone. I know a couple of office hours back, we asked you all what you would be interested in hearing more about, and we heard antibiotic stewardship and enhanced barrier precautions. And so back at the beginning of the year, the Alabama Nursing Home Association actually had 2 webinars specifically for those 2 topics. And so I'm just going to drop into chat those recordings. I will say a disclaimer that there may be some verbiage on getting CEs, but because this is a recording, that won't be available, obviously, when you're watching it, because it's not live. So if you want more information on that, just be sure to save the links that I'm putting into chat now. Thanks so much.
Perfect. Thank you so much, Melanie. So at this time, we are going to get started. I have my colleague, Amy Ward, whom y'all heard speak before. She's our patient safety manager, and she's going to present questions and updates that have happened or questions that have come in over the past several weeks since we last met around NHSN. So Wade is going to be keeping an eye on our chat and Q&A as I pull up Amy's presentation.
All right. So as Beth said, I am the patient safety manager with Alliant Health Solutions. And I'm just going to go over some of the recent NHSN updates. I know NHSN offered several webinars and replays, and the slides are up on their website now as well. But we have received several questions over the past few weeks, mostly very similar questions. So we're just going to go through and provide some of those updates for you. So next slide, please. So the up-to-date definition was updated for Q3. And because NHSN uses a surveillance type definition and protocol, they are updating these as needed on a quarterly basis so that we are comparing similar similar populations over the quarter. So beginning on June 26th, the up-to-date definition was updated by NHSN. The link is updated in the module as well. When you're entering your data, you can always click that link to refer to the most recent guidance. But currently, as you're doing your reporting for residents and staff, any individual is up to date once they have received a single bivalent vaccine, and that can be from Moderna or Pfizer. It's the same for all residents and staff, regardless of their age or immunocompromised status. CDC does offer an extra vaccine, or there's a recommendation if somebody wishes to have an extra dose of this bivalent booster, they can, and that's not going to change how you report up to date in NHSN if they receive a second bivalent dose. Next slide, please. The NHSN also updated some of the data entry forms, as well as simplified the fields. And that also began the reporting week of June 26th through July 2nd. So many of you have already seen these updates and reached out for assistance. If you are someone on the call who doesn't regularly do the NHSN reporting, but you're maybe going to log in to cover for somebody's vacation, hopefully that's the case, then you will see these updates when you log in next. Next slide, please. So the bulk of the changes to the resident form for COVID-19 vaccination, question 1 had no change for the number of residents at the facility during the reporting week. They did remove 2.1 and 2.2, so those are the questions pertaining to the primary series. There was no change to question 3.1 through 3.3. And then number 4 was removed, which was the cumulative number who've received the primary vaccine, and 4.1 was removed, which was who hasn't received a booster dose, and 4.2 was removed, which is those who have received more booster doses. So this is overall going to be simplified, which we'll look at on the next slide. And it's going to make your math a lot easier as well. So next slide, please. Okay. So by removing the primary vaccine and booster dose questions and keeping question 1 and 3 through 3.3, question 5 was moved up to question number 2. So these changes will be shown on the new form on the next slide. So this is a lot easier now. So number 1 is just the number of residents who had at least 1 day at the facility during the week. Number 2 is the total number who are up to date. And number 3 plus number 2 need to equal number 1. So the 3.1, 3.2, 3.3 plus number 2 need to total your residents in number 1. This is where we had a lot of confusion coming in over the past week. So if somebody is not up to date, they need to be accounted for either through a medical contraindication, a declination, or unknown status. Again, the total of 3 and number 2 have to equal number 1 in order to save this data. Next slide, please. The healthcare provider form also was simplified to remove question 2.1 and number 4. Next slide, please. Again, the old form looked like this, and number 2 and 2.1 were removed. Number 5 was moved to number 4, and questions 1, 2, and 3 remain. So if we go to the next slide, we can see the updated summary form, which shows us that number 1, again, is the total number of healthcare providers who worked in the facility or who were eligible to work in the facility at least 1 day. Number 2 is, again, the completed primary, or, I'm sorry, the up to date And then number 3 is going to be those other status. I'm sorry, I said that wrong. Number 2 is the completed primary series, and number 4 is the up to date. This is another screenshot for question 2 in the resident form. That is your up to date total. And again, you can click that link where it says key terms and up to date vaccination. That will bring you directly to the most current up to date guidance for how to report up to date. And on the healthcare provider, again, that's in question number 4. So this is our patient safety team. And if you do have questions or need assistance with NHSN, we are happy to help you. And I will drop our patient safety team email into the chat for you, and you can feel free to reach out anytime. And we will do our best to get you as real time as possible assistance. And if we're not able to assist you, we will get you connected with the NHSN help desk. And that is all I have. And I'll turn it back over to you, Beth.
Okay, thank you. So as you think of questions or comments, please feel free to enter those into chat, and we'll be keeping an eye on that. And if we can't get to your question, or we don't know the answer, the perfect answer for you today, we'll definitely have that question and get back with you. So at this point, I want to go ahead and turn it over to Melanie Roderick with ADPH.
All right, so as usual, we're just going to go over some questions that we've received since our last office hour call. Those questions today are going to focus on COVID-19 and enhanced barrier precautions. So as I'm sure you all are aware of by now, the COVID-19 by county webpage has been reformatted. So prior to the update, you all were able to scroll down, select the state and the county that you were looking for the COVID-19 hospital admission level for. But now when you go to the webpage, in that same section where you would have selected the state and the county, there's just an icon that says view COVID-19 data. And when you click on that, it takes you to the COVID-19 data tracker. And so once you scroll down a little bit further on that web page, you'll see a US map titled COVID-19 hospital admission levels in the US by county. And all you have to do is just hover over your county, and you'll see all of the data elements that you previously saw on the COVID-19 by county webpage, including the hospital admission levels. As of this morning, all counties have low hospital admission levels. So we're still getting some questions about masking. So we all know that there are certain circumstances where masking would be recommended, specifically for those that are suspected or confirmed to have COVID-19, or anybody who's had a close contact or a high-risk exposure with somebody who has COVID-19 for at least 10 days after their exposure. When we are talking more about broader masking, there are 3 scenarios where you should consider masking at a broader level. So if a healthcare provider is working, or you've got residents who are residing on a unit with a COVID-19 outbreak, masking would be recommended. Additionally, when the community hospital admission level is high, or for those that are high risk of getting sick when the community hospital admission levels are medium. So the initial question was, do staff have to wear masks all the time? And so no, they don't have to wear them all the time, but just keep in mind that if someone meets the criteria for either having a suspected or confirmed infection or having a close contact, they should mask. And then for broader masking, those 3 criteria that we just talked about. We've also gotten a question about the COVID-19 vaccination, whether a medical or religious exemption is still required. So as of now, there's not a requirement for staff to be vaccinated for COVID-19, which eliminates the medical or religious exemption rule. However, CMS does continue to encourage all healthcare providers to be up to date with the COVID-19 vaccine. So those are all our COVID questions. The remaining questions will be specific to enhanced barrier precautions. We got a question about the implementation of enhanced barrier precautions for a resident who needs to shower. So before I go into the details, I will say that the recommended use of PPE would be for healthcare providers in this situation to have at least 3 sets of PPE. So we'll go through what that looks like right now. So of course, staff would need to don entering the resident room, provide patient care there. And then as they are getting ready to go to the shower room, they would doff upon exiting the resident room. They would transport the resident to the shower room, don their second set of PPE, bathe the resident, and then doff that PPE that they just used during the bathing session with the resident. They would transfer them back to the resident room, don PPE again, do what they need to do in the room as far as getting the resident out of the wheelchair and back into the bed or the chair or wherever that resident's going to reside, and then doff that PPE as they're exiting the resident room. So the highlight is that enhanced barrier precautions is not recommended to be used in hallways. And there's actually an FAQ on the implementation of enhanced barrier precautions CDC website. And there's some details that kind of speak to this question. So the FAQ is, are gowns and gloves recommended for enhanced barrier precautions when transferring a resident from a wheelchair to a chair in the day room or dining room? So in general, gowns and gloves would not be recommended when performing transfers in common areas such as dining or activity rooms where the contact is anticipated to be shorter in duration. Enhanced barrier precautions is primarily intended to apply to care that occurs within a resident's room, where high contact resident care activities, including transfers, are bundled together with other high contact activities such as part of their morning or their evening care. As we know, this extended contact with the resident and their environment increases the risk of MDRO spreading to staff hands and clothes. So outside of the resident rooms, enhanced barrier precautions should be followed when assisting during bathing and in a shared or common shower room, and when working with residents in the therapy gym, specifically when you're anticipating close physical contact while assisting with transfers and mobility. And then of course, hand hygiene needs to be done before and after resident contact. So it's okay to use the same PPE for multiple care activities with a resident that are happening in the same place at the same time. But again, the recommendation is not to use the PPE for enhanced barrier precautions in the hallway. And really the overall focus of enhanced barrier precautions is related to that prolonged close contact care, which is often bundled together. So the next EBP question that we got has to do with residents with a colostomy bag and if they need to be placed into enhanced barrier precautions. I reached out to CDC about this. They do not consider residents with a colostomy bag for enhanced barrier precautions unless that resident has other indications such as a wound or an indwelling device or a history or an active infection of an MDRO. We were also asked about C. diff and why it's not considered for enhanced barrier precautions when a resident has been diagnosed with it and they're more likely to get it again. Enhanced barrier precautions are really intended for MDROs, and they do not replace existing guidance using the use of contact precautions for other pathogens such as C. diff, scabies, and norovirus. So there is another FAQ on the implementation of enhanced barrier precautions on CDC's website. It's FAQ number 5, are enhanced barrier precautions recommended for residents with C. diff or scabies? I can drop that link if you all are not familiar with it into chat. There's several FAQs that help with understanding how to apply and implement enhanced barrier precautions. Additionally, you can refer to Appendix A within CDC's guideline for isolation precautions for a list of infections and other conditions where contact precautions is recommended. And again, if contact precautions is recommended for that pathogen, then you would still implement contact precautions and not substitute with enhanced barrier precautions for these listed pathogens. So the last question has to do with a respiratory protection program. We know that there are some facilities that do not have a respiratory protection program. And so we just wanted to remind you all that it is an OSHA requirement. So whenever healthcare providers are using respirators, the employer must implement a written worksite specific respiratory protection program, which includes a medical evaluation, fit testing, training, and other elements as specified in OSHA's respiratory protection program standard. So if you're on the call and you do not have a respiratory protection program, reach out to your strike team contact. They can share resources and guidance to help you develop and implement a respiratory protection program. And that is all I have today. Thanks so much.
Thank you, Melanie. And we do have a question in chat. Do nurses have to wear a gown when giving medication by a feeding tube?
Is this for a resident that is supposed to be, that has an MDRO or a wound, or is this specific to enhanced barrier precautions? I guess is what I'm asking.
And maybe Deb can give us a little bit more detail on that question.
Hey, Melanie, Deborah Littlejohn answered that in the Q&A, and she said yes for enhanced barrier precautions.
I'm not 100% sure, but I feel like there is an FAQ on this. Amy, do you know off the bat?
Thanks, Melanie. I am just thinking, from nursing practice, I'm a nurse, and if the resident requires enhanced barrier precautions, then yes, that is you're doing a medication pass, you're having close contact with that resident. So I would say the answer is yes, if they do require enhanced barrier precautions. I would also add that as a part of standard precautions, if the resident is not in enhanced barrier and they are not in contact precautions, I would also consider from standard precautions. I know there's been multiple times that I have administered through a G tube and, the syringe comes off and there's a splash. Personal experience, and I would have definitely preferred to have a gown on and some gloves in that case. So yes, I would also consider standard precautions and consider the use of a gown and gloves just per standard precautions due to splash risk and exposure to bodily fluids.
Thank you, Amy and Melanie, and hopefully, Deb, that answers your question. And Wade, do we have other questions in Q&A?
Yes, we've got one more. It's from an anonymous attendee. It says, from an IPC standpoint, what is recommended for incontinence / peri care? Washcloths and peri cleaner or disposable wipes?
Thank you. We just we're actually researching this in relation to a urinary tract infection webinar that we did yesterday, and the CDC UTI guidelines, I think they're CAUTI specific guidelines, do not recommend a specific type of cleaner. It was not a high level recommendation. It was kind of a low level recommendation. So I would, refer to your nursing practice standards and make sure you're following, standards for nursing practice in your facility and make sure that's in your policy and procedure. And if you continue to have a UTI issue, then you can consider the use of a different agent. It is not recommended to use a antiseptic from the CDC guidelines.
Thank you, Amy. And is there is a recording link to that educational event yesterday, correct, Amy?
It is not available just yet. It will be available on the website in the coming days. So please feel free to check that out. And I will look for the CAUTI guidelines and I'll drop those into chat as well.
Thank you. Okay, I'm not seeing any more questions or comments in chat at the moment. What about the Q&A, Wade?
There's no more in Q&A, but on up in chat, Beth, Stacy Taylor made a comment that she got an alert in the last 2 weeks when logging into NHSN on stating data is not reported % total resident up to date. But by her numbers, they're in and match and reported in NHSN on weekly reports required.
Thank you, Wade. And Amy, maybe you can speak to that. I know someone else had reached out with that same question a week or so ago, and I copied the patient safety team on that. But Amy, do you have any feedback on that question?
Yes. So if it is a quality alert in NHSN, then you can go in and resolve that quality alert. I will drop a PDF into the chat for you on how to resolve a quality assurance alert in NHSN. If the issue persists, then please feel free to reach out to NHSN at cdc.gov so that they are aware of the issue. But I believe this is a known issue and they are working on resolution, and the PDF that I just put to chat will show you how to resolve that quality alert. If it is not a quality alert, please feel free to email the patient safety team, patientsafety@allianthealth.org, and we will be happy to log in with you and view the alert and see if we can help you with that.
Thank you, Amy. And someone did put in chat that they got the same alert, and NHSN Help Desk said to ignore and that they were aware.
It doesn't affect the CMS data view. So CMS will still see your data is entered. It's the NHSN had set up rules to make sure that implausible situations, such as you had 10 resident days but reported 100 new COVID infections. It was to prevent situations like that where there was a data entry error. However, I think the updates might have messed their algorithm up, and so they are working on resolution from what I understand.
Perfect, thank you. No other questions that I see in chat. Wade, do you have anything on your end in the Q&A or something else in chat that I missed?
No, ma'am.
Thank you, Wade. So while we take just a minute, we do have something that came in. Prior to starting my weekly COVID reporting, there are 2 alerts that pop up stating I have 2 vaccination summary alerts. I've completed my NHSN reports as usual. Don't know what I'm doing wrong. I answer all the questions correct. I'm able to load the data I entered and print out the report.
So I think you can click on those alerts and it should take you to the missing summary weeks. If that's not the case, we would be happy to assist you, Beverly, if you want to email that patientsafety@allianthealth.org. But I believe clicking on the alert will take you to the 2 missing summaries, and you can fill those in to the best of your knowledge. Again, those should not affect your current data submission to CMS for their mandatory reporting requirements. But I know having alerts on your dashboard or your landing page in NHSN can be concerning or annoying. So feel free to click on that to see where that takes you and resolve those. Otherwise, feel free to email us and we will assist you.
So as we're waiting to see if there might be other questions or comments, we do want to thank you for being with us today. We certainly don't want to, we know your time is valuable and we don't want to hold you over if there are no more questions or comments, but we want you to know how much this team values your engagement. We hope that you continue to find these sessions to be helpful for you and your team. And we just remind you that we don't want you to hesitate to reach out with questions or comments even after these sessions, because your question may very well be someone else's. And so that's why we like to collect these between our meeting times. And Melanie does a great job of sharing those questions that we've collected between our office hour meetings. So please feel free to continue doing that. Yes, did someone have a comment?
Yes, this is Melanie. I actually have a question for the group. I am still following up to try to figure out who to contact to stop or pause the automatic testing supply shipment for COVID-19 to our long-term care facilities.
Yes.
Successfully gotten an email back from CDC, and they're asking, and I don't know the answer, so I'm going to see if anybody on the call knows, what program is the one that is sending the test supplies. So he gave me a couple of examples: Operation Expanded Testing, ICAT, ASPR, HHS. Any other details? Because I think, I mean, it may be coming from HHS, but there's several programs under HHS that have been sending testing supplies to facilities. So I don't know if when all this started, there was like some formal paperwork sent to the facility that said, you know, your facility is selected to receive automatic test supplies. I'm not sure how it was set up, but I haven't responded back to him because I've emailed a couple of people back that have reached out to me personally, and they were going to try to figure out an answer. But if anybody knows the answer to what program specifically is sending you all the testing supplies, that would be very helpful. If not, I'll just go ahead and reply back to him and say, I'm not sure. And maybe he can figure out what next steps we need. But oh, there's something here. Katrina says some members have approached the
I was going to say, Melanie, I just put in the chat. I had brought this issue up with some other healthcare associations across the nation, and what I've put in the chat is what I heard from them on how to stop those shipments.
Great.
This is great. Will you be putting this in the weekly roundup too, Katrina?
I can go ahead and do that. I had not planned on it, but I'll be happy to add that in.
Thank you for doing that, Katrina. Well, again, we want to thank you for being with us today. Keep your eyes on the weekly roundup, and that is where we will promote the next date for our Alabama IP office hours. Feel free to communicate with us in between. We appreciate that. And we hope you have a wonderful afternoon. Thank you for being with us.